I'm Jennifer Bjorklund, and this is Ask the Doctor, a Lifescript Cedars-Sinai Women's Health Report. Is that a little twinge in your hip, or could it be an indication of a bigger problem? Close to 330,000 hip replacements are performed in the U.S. each year, and not all are a result of aging or arthritis. Most people are over age 60 when they opt for a replacement, but that number's changing as younger patients choose surgery so they can remain active. But does it need to be hip replacement? Not always. Lifescript's Mari Cartel tells us why.
Software engineer Rhonda Glennon was an active 33-year-old woman, kickboxing, hiking, flying small planes. Like many active women, Rhonda was wearing out her hips.
Honestly, I felt like maybe it wasn't real. I should just stop doing the things that I like to do with physical activities.
Hip pain began cramping her style.
Those bones would start to rub against the cartilage, and it's over time just kind of tore it up and wore it down. And that's where the pain was coming from.
She was later diagnosed with hip impingement, when excess bone in the hip and thigh socket rubbed together, causing pain. Dr. Justin Salomon, an orthopedic surgeon at Cedars-Sinai Orthopedic Center, explains.
Basically, you have a ball and a socket that form the hip joint, and sometimes the socket is overgrown, and as you move your joint, it hits. And what lives between, right on the end of the bone, the suction cup that goes around the socket, is called the labrum. So that can crush the labrum and start to hurt the cartilage.
When physical therapy didn't work and hip replacements seemed inevitable, Rhonda searched for other options. She finally found a new, less invasive solution. Through 3 tiny incisions in the hip, Dr. Salomon surgically shaved away the excess bone. For Rhonda and others suffering from hip impingement, the procedure was a hip saver.
I believe that we're going to have a much better opportunity to give patients preservative treatments for joints that get them back to having an effective, pain-free joint, but also prevents problems down the line.
3 weeks later, Rhonda was back on her feet and headed toward a full recovery.
Really excited about getting back into doing the things that I wanted to do that I had stopped doing in the past. I believe over the next 6 to 12 months, I'll be up and running in full steam again.
From Cedars-Sinai Orthopedic Center in Los Angeles, I'm Mari Cartel.
Thank you, Mari. We're joined today by Dr. Justin Salomon, an orthopedic surgeon at Cedars-Sinai Orthopedic Center. Dr. Salomon, thanks so much for joining us. Hip replacement sounds so scary, but you have some techniques that can help people avoid hip replacement down the line, right?
So I think all of us who do the procedure believe that it will likely reduce the risk to having a replacement later on, but it'll take 20 years of studies to prove that it prevents hip replacement surgery or decreases the chances of needing it. However, what it does is it effectively treats patients' pain in the short term and probably gives them a better hip than they would have otherwise for the rest of their life.
Can you describe the difference between a normal hip replacement and this new procedure?
So this procedure is an arthroscopic procedure that's done as a way to help patients restore function and decrease pain when they're not in an arthritic state that's severe enough to require hip replacement surgery. So this surgery doesn't replace replacement, but it's done at an earlier stage in the disease to treat the symptoms effectively, decrease pain or cure the pain, and very likely prevent progression to an arthritic state that would require replacement.
How common is hip impingement in, say, women under 40? Is that increasing?
It's incredibly common, and it's always been there. We didn't always recognize it, but it's always been there. We're more and more commonly recognizing the problem in its earlier phases, and the treatments have been really exciting. So this is a burgeoning area of orthopedics that has everyone in the community talking, and we're all very excited that we can now treat something that was unrecognized for so long and then treated with big open procedures previously, and now we can do this through tiny little poke holes.
So are hip impingements mostly because of arthritis, or is it just overuse?
We know that hip impingement leads to arthritis later in life. The question is, will our arthroscopy, our surgery through 2 little poke holes or sometimes 3 little poke holes, prevent you from needing a hip replacement later? Probably, in my opinion, yes, but it will take literature and years of studying to prove it. But what we do know from studies is that it effectively treats the pain that patients have been living with and told that there was nothing we could do. They have a hip strain or whatever they may have been given as a diagnosis, because they had maintained joint spaces. They didn't have arthritis on x-ray yet, so they weren't given any other options.
So how many doctors on average has a patient seen before they end up in your office?
It's not uncommon for the patients to have seen several physicians who did not offer up the right diagnosis or solution to the patient's pain and symptoms.
Can you blame it on other things? I mean, what are women specifically doing wrong? High heels, really heavy handbags on the shoulder, are these some causes?
I'm not going to blame it on any of those things. It's more of a genetic propensity and bad luck. And the more active you are, perhaps the earlier you'll have symptoms if it was in your genetic program to begin with.
Are women setting themselves up by being too overactive, or are there certain exercises or activities that can make you fall victim to these hip injuries?
And I'm not really of that philosophy either. I think people need to do the activities that they enjoy that make them feel fit, both on a mental health standpoint and also a physical body standpoint.
So what other non-surgical or natural procedures are there that you can do to prevent hip pain or reduce it?
Well, that's part of what's so exciting about this is there really haven't been good surgical options for this problem. So patients have been forced traditionally to find other ways to manage their symptoms. And I believe in acupuncture, and obviously anti-inflammatory medicines can help, but there's not a great answer. You don't want to lose your motion, but sometimes stretching causes the areas that are hitting to impinge and can make symptoms worse. So while I think physical therapy is an important thing to try and it can mitigate symptoms to some extent, sometimes the pathology wins and patients end up needing to have something more done than conservative management.
What tips do you have for avoiding hip pain at any age?
Well, I think for any joint, it's important to maintain flexibility and strength and realize that when we go out and play 110%, we need to have the ability to play 110%. And sometimes as we age like myself, we go out on the weekends only, and that's a recipe for injury. We call it a weekend warrior.
It's good to know there's a solution out there. Thanks so much, Dr. Salomon, for talking to us today.
Thank you for having me.
And if you want more information about hip replacement prevention, visit our health centers at lifescript.com or Cedars-Sinai at cedars-sinai.edu. This has been Ask the Doctor, a Lifescript Cedars-Sinai Women's Health Report. I'm Jennifer Bjorklund.